This is a brief history of pandemics presented by the Division of Geriatric Medicine at St. Louis University. In a year of a pandemic, it is perhaps useful to look back on history and perceive how pandemics have come before and also gone away. The first major pandemic was the Plague of Athens. It was in 430 to 427 before Christ's era, and it was most probably either measles or typhoid. It had about 75,000 to 100,000 deaths. The description of it was by Thucydides, who said, violent heats in the head, redness and inflammation of the eyes, throat and tongue quickly suffused with blood, breath becomes unnatural and fetid, sneezing and hoarseness, violent cough, vomiting, retching, violent convulsions, the body externally not so hot to the touch, nor yet pale, a livid color, inkling to red, breaking out in pustules and ulcers. And next to this, you see Myrtis, the young lady who basically skeleton was found much later, and she was then recreated as a sculpture. Particularly important that Thucydides actually pointed out there was a particularly high mortality among doctors, and this has remained through all the pandemics in the world. The next pandemic was the Antonine pandemic, occurred in 165 to 180. It basically talked about 6 million people becoming dead, most probably from smallpox. Most of the dead were in the urban areas. The economy fell apart in Rome, and politics were chaotic. It was first described by Galen and was appeared to come to Rome by basically the Roman soldiers coming back from the Near East. Smallpox was eradicated in 1980 from the world. The plague, or Black Death, occurred in 1346 to 1353, and people believed it was spread by poisoned air, which they called miasma, but in fact it was really due to rats, which brought the Yersinia pestis plague with the fleas, and there were 200 million deaths throughout Europe. Then we came to cholera. The third cholera epidemic took part in 1846 to 1860. It was predominantly throughout Russia and London. Greater than 1 million people died. Lots of strange remedies were pronounced for it, including being temperate in eating and drinking, basically as one. But in addition, eventually it was found to be in the water supply in London at the London Tap, and this is called Death's Dispensary. There stands a copy of the tap to this day in London, and it was John Snow who discovered this, and by getting rid of the tap and the water, cholera was cured for that time. Next big epidemic we want to talk about is what is called the Spanish flu. Spanish influenza occurred between 1918 to 20, and while it was called the Spanish influenza, it actually began in Camp Funston in Kansas City. One of the soldiers from there went to the World War I and started to spread it, and eventually it was recognized first in Spain, being called the Spanish influenza. It's an H1N1 influenza. 50 million people were killed, and importantly, it's one of the few pandemics where the major people who died were in their 20s. In the corner there, you see that Philadelphia decided not to do a lockdown, and their death rates went sky high. Whereas if you look towards the bottom here, you will notice that St. Louis did the lockdown immediately and had much less deaths. Wearing masks was considered essential, and this was the lesson that we still have to learn today. The influenza pandemics after the Spanish influenza in 1918, It was followed in 1957 by the Asian influenza, an H2N2 influenza virus, being a combination of avian flu and human flu with reassortment. Then in 1968, we had the Hong Kong influenza, the HCN2 influenza virus, consisting of avian flu and human flu again. And then we had, in 2009, a virus that began in Mexico and spread throughout the United States. This has become known as the American swine flu because it was a combination of classic swine flu with human flu and avian flu. When we go on from there, we notice that there have been many other epidemics, some of which we do not sort of put in the criteria of pandemics. The example would be the American polio epidemic, which began in 1916, but remained around till after 1955, when Jonas Salk invented the inactivated polio vaccine. HIV or AIDS has killed some 25 to 20 million people since 1981. The Western Ebola epidemic began in 2014 to 2016 and has had 11,343 deaths. And just this year, a few days ago, there was a new outbreak of Ebola in Central Africa. And then finally, the Zika virus epidemic, which is carried by the mosquito, is another form of panepidemics. The Marburg virus, which finished up killing 383 people, is the only virus that is known to have been made in a laboratory. It was being studied in Marburg and other parts of Germany. There was an escape of some of the animals being treated, and this led to the Marburg virus, which, having first outbreak in Marburg, then spread to southern Africa and Africa. It's transmitted by direct contact with blood, secretions, organs, body fluids, and tissues of infected persons. And it also occurred by handling ill or dead infected wild animals, such as the African green monkeys and the fruit bats. You see over there on the far side of the slide a picture of Marburg in Germany. In 1967 in Boston, Ken McIntosh of Harvard Medical School was part of the team that discovered the first of the coronaviruses, and this is recorded in the Children's Hospital archives. Coronaviruses have created a number of severe illnesses. The great example before the present time was SARS, which came about in 2003 and killed 774 people, giving the severe acute respiratory syndrome. You can see it had these spiky glycoproteins on the outside, and you can see that it traveled through a vast amount of the world, including the Americas, Asia, and Europe. The Middle East respiratory syndrome is another coronavirus. It's basically caused about 862 deaths and occurs obviously mainly in the Middle East. And now today we have the coronavirus, COVID-19 pan-epidemic. The rate of death has varied from very low in Taiwan, 0.03, to very high per 100,000 population, to much higher in Belgium. The United States is about 31 per 100,000 deaths. And we can see Belgium and Spain, the United Kingdom, have had very high death rates. We know that this COVID-19 causes a cough, dyspnea, hypoxia, and along with that, a severely high fever, except in older people where often the fever is absent. It can cause hepatitis. It causes myocarditis and myocardial infarction. Because of peripheral vascular disease, it can cause chilblains, but also widely spread is deep vein thrombosis, leading to pulmonary embolus. It can produce kidney injury, myalgias and muscle wasting with cachexia, colitis leading to diarrhea, In people with type 2 diabetes, it can convert them to a diabetic ketoacidosis. Anosmia, anorexia are also important components. And in the central nervous system, we see delirium, falls, encephalitis, and stroke. It should be noted that the X-rays show a specific pattern of a pneumonia, which together with the cytokine storm is the reason for the death in the majority of people who have COVID-19. Should be pointed out that also with COVID-19, you can tell that it is about to come by measuring COVID virus in the sewage, and it peaks before you see about 3 to 4 days before you see the peak of COVID in the community. COVID-19 so far has killed over 100,000 people in the United States, and that's about equivalent to the 79,000 people that were killed from the H1N1 flu, which occurred in the United States in 2018. So while it is killing a large number of people, it has not become more dangerous on a yearly basis yet than the influenza, which we already have a vaccine for. So here we show you Marilee Shapira-Asher, and she is famous for being the only person we know who basically had the Spanish flu back in 1918, and at 107, she had COVID-19. She is now living at age 108, was a very famous sculptress during her lifetime. And so to conclude, we need to remember that pandemics will come, they will often go. They may go when there's a vaccine, but most importantly, social distancing, keeping people 6 foot or 2 meters apart, and then importantly, wearing a mask. You wear the mask because basically the mask protects other people, and it's absolutely essential. This was shown best perhaps by Banksy's revision of his painting in Amsterdam or Hamburg, sorry.